Hello guys, welcome back to my channel Dentistry for Beginners. So guys, today we are going to study about this topic which is growth spurts. Growth does not occur uniformly at all times. It means growth it doesn't occur uniformly. It occurs in a ununiform way. Sometimes it's more, sometimes it's less. So that is why this growth it doesn't occur uniformly. Okay. There are periods when a sudden acceleration of growth occurs. This sudden increase in growth is termed as growth spurts. So there are periods when there is sudden acceleration. All of a sudden, the growth is very much increased. So that sudden increase, that is growth spurts. Like growth is happening, but in between sometimes it is very happening very rapidly, very speedily. So that acceleration is known as growth spurts. The reason for this sudden acceleration of growth is the physiological alteration in hormonal secretion. So there is some kind of physiological alteration in the hormonal secretions. That is why there is this sudden acceleration of growth. The timing of growth spurts differ in boys and girls. So the timing of this growth spurt, this sudden acceleration, is different in boys and is different in girls. So at different time period, we will see the sudden increase in growth in boys, and comparatively at some other age time period, we will see the sudden acceleration of growth in girls. The following are the timings of growth spurts. So there are four stages where we can see this sudden acceleration of growth, which is growth spurts. The first is just before birth. Second is 1 year after birth. Third is mixed dentition growth spurt. Fourth is prepubertal growth spurt. So mixed dentition growth spurt. The mixed dentition growth spurts, the timing in boys and girls are, as we have already studied, that the timing is different. So in boys, this mixed dentition growth spurt can be seen at the age of 8 to 11 years. Whereas if we see in girls, the mixed dentition growth spurt is seen at around 7 to 9 years. So in girls, it is earlier compared to boys. Now, pre-pubertal growth spurts, just before puberty, the growth spurts which are appearing. So, in boys, this occurs at around 14 to 16 years of age, and in girls, it is around 11 to 13 years of age. So, again, in girls, it is earlier compared to guys. Growth modification by functional appliances are carried out during growth spurts. So the growth modifications, growth is happening and we want to modify that growth. So how we can modify that growth? By help of functional appliances, which we will learn in other videos. So with the help of this functional appliance, the growth which we want to modify, this is carried out during growth spurts. Whenever there is the period of growth spurt, that sudden acceleration growth is there. At that moment of time, we can use these functional appliance to modify the growth. Surgical correction should be carried out only after cessation of the growth spurts. So the growth modification which we were doing during the growth spurt phases, that is modifying the growth pattern of a individual. So what happens when growth is completed? The growth spurts they are completed. Then if we want to modify the growth pattern, then how we can do that? That we can do with the help of surgical correction. So the surgical correction thing is very important because surgically, if we want to correct something, that we will do only after cessation of growth spurts. Because then, when the growth spurts are ceased, then what happens? There is no further growth. So now we can modify it accordingly via surgically, and then the results will be like stable. There won't be any further growth that will happen. So we will get a stable result if we will perform a surgery after cessation of growth. So that is why this topic is particularly very important, growth spurts, because in orthodontics, what is basically seen is the modification of growth. So we have to see in the child whether the child is in growing phase or the child have completed its growth. Accordingly, we will plan the treatment. If the child is in growing stage, that means growth spurts are there. That means we can use functional appliances to modify the growth. But if the growth has been completed, then we will go for the correction via a surgical way. So this is why it is extremely important, and this is very, very, very important topic if we consider as a part of orthodontics. So that is all for this, and thank you so much. I hope you're really enjoying, and please do subscribe my channel and do like the videos, and stay tuned for more similar videos. Thank you.